What's going on, YouTube fam? Alright, I'm coming at y'all with a video. It's a request from my girl, Funky Fun and 40. Hey, Robin. If you guys are interested in your nursing students and you're interested in following somebody's nursing vlog while they're in clinicals outside of mine, check out Funky Fun and 40. Robin, awesome. She makes great videos. Also check out Nurse Brown Skin. If you are ever, I guarantee, if you're ever having a bad day in school or clinicals or anything like that, and it's just kind of, you feel like you're overwhelmed, Nurse Brown Skin gives the most uplifting, encouraging videos. She's a nursing student. Y'all check out her story. If she can make it through nursing school, anybody can make it through nursing school. I'm telling you, watch her videos, hear her story and the things that she's been going through while going through nursing school. I'm telling you, it'll give you that boost, that kick to do what you need to do and get it done. You know, because she's doing what she need to do. She is you talking about somebody on the grind. She is on the grind. So is Funky Fun and 40. You know, she's got a life. She's got family, kids. She is on her grind, both of them. And there's a whole bunch of other nursing channels that I watch. You know, Renee for Christ. She's graduated, but the one thing I love about her channel is she didn't just graduate and just like stop, you know, as far as making videos. She makes videos about all different type of things. Her videos are uplifting and encouraging as well. Tips on how to study, even though she's not even in school anymore. She's working as a nurse. So her videos are great. Who else? Nurse Nicole. Mishka. I'm sorry. Y'all, come here. My dog is going, she's going in. She's going, say hi. 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 It's my baby. It's my Mishka. So anyways, on my last video, I did a little, I think I tagged Nurse Brown Skin and Robin to do study tips and to do their organization on their folders and stuff like that. And Robin tagged me right on back. So I'm going to do my study, how I study. And the reason why it's a good time to do that, let me tell you my schedule. Next week, Friday, vitals check off. Monday, October 10th, I have an AMP3 lecture exam. October 11th, Tuesday, I have nursing exam. October 12th, Wednesday, AMP3 lab practical. Y'all pray my strength in the Lord. Okay. So anyways, no, I'm just kidding. I feel like I'm prepared. I've been preparing myself. So I'm just going to give you a quick rundown on how I'm going to be studying for those 4 things. So I'll start with my flashcards. I do flashcards. I take my PowerPoints and the notes. If you watch my how I organize my binders, you'll see my PowerPoints and all the notes written on them. I take them, my notes, and I kind of like consolidate them to flashcards. My flashcards aren't fact-based or like define this, define that. My flashcards are, they kind of ask questions. I give you a prime example, like, instead of saying, what is a goal? What's the definition of a goal? And what's the definition of an outcome? I do goal versus outcome. What's the difference? And give examples. So I know that I have a clear understanding of, you know, the difference between the two, examples of the two, and things like that. Also, I give examples of, you know, the aims of nursing, to promote health. I'll write like a question out saying, a nurse is talking to a class of high school students on the risk of, you know, smoking. What is this an example of? It's an example of, you know, promoting health. You know, one of the 4 nursing aims. So I do questions like that. Also, mixed in with my flashcards are stuff that we learn through lab, because that's going to be on my exam as well. Not only lecture, but the things that we learned in lab. In lab, we went over Asepsis was the first thing we went over. We went over vitals. We went over nursing diagnosis, and we just did physical assessment, hair, skin, and nails. We also did the first part of assessment would be like the history. You know what I mean? So what I do is I'll write flashcards, but I'll go and pick very important things that I know are key factors they'll probably test you on, and make a flashcard out of with that. And I'll ask questions. I'll make more like questions, kind of like testing myself. Like, prime example, you have a patient that's come in the hospital. You've already performed hand hygiene. You've already introduced yourself and checked their ID badge. And you're going to take blood pressure. When assessing the patient, you notice that they've got a cast on the right arm and an IV on the left arm. What do you do? How do you take the blood pressure? So I ask myself questions like that. You would take the blood pressure on the right or left side. So those are the type of questions that I ask myself, or that I make flashcards with. Also, I go over, for lab part, I go over this book, My Clinical Nursing Skills. All our skills that we learn are out of here. It has the skill, the steps, and then the rationales. And I know the steps. I've done this. I've done it in lab, so I should already know the steps. What I pay attention to are the rationales, because those are the things they're going to test on. Not how do you do this, but why are you doing this? So to make sure you have a clear understanding. As far as vocabulary, I'm sorry, y'all. As far as vocab goes, or key terms, at the beginning of each chapter, for lecture and for lab, because we have to read chapters for both, I write down the key terms or the key words, and I put the definition, and I don't make flashcards off of those. What I do is I'll reread over them and reread over them. Once I've learned something, I now use it. I put it in my vocab, and I've been using the correct terms or medical terms for things, instead of saying so and so had is in pain because of. I'll say, Mr. So and so is in pain. I'll use the correct term or etiology, instead of like when we're writing a nursing diagnosis. I use the correct terms. What else? Oh, math calculations will be on my first exam. And because this is my first nursing exam, it's going to be pretty much like old school conversions, ounces to tablespoons, cups to ounces, ounces to pints, and stuff like that. Well, they don't go over that in class. They expect you to know that. You went over that in math class, whatever math you took prior to getting the clinicals. You should already know that. If you don't know it, it's your job to catch up on it or refresh yourself. So what I did was I went to my professor. I said, do you have any handouts on conversions? And she said, I got a ton of handouts. And she gave me her handouts. So I stayed after class today, and I did one of the handouts. I showed my work on it, and then me and her went over it. And that's what I'm going to continue to do all week. I'll do it at my own time at home. It doesn't get graded. It's just it's to help me. So when I take the test and I see a math question, I'm on it. Another thing, like I said, we went through nursing diagnosis and writing nursing diagnosis. Well, I really can't make flashcards on that. I can maybe make a flashcard on like the different types of diagnosis, nursing diagnosis, which would be, actual problem, risk, things like that. But they may not ask questions like that. They're probably going to ask, show different scenarios and ask us to write a nursing diagnosis. So I asked my professor, do you have any case studies? And she said, well, Toya, yes, I do. So she gave me a packet full of case studies. And each case study has, for each case study, you can write about 4 or 5, some 15 nursing diagnosis. So I'm going to work on these on my own time. I'm going to hand them into her. She says she'll check them for me and see if I'm on track. And that's a way for me to study. So when that's on the exam, I'm on point. I'm on top of my game. If you want A's and B's and whatnot, and in clinicals, you have to push yourself. You have to do some extra steps. You have to do some outside work and some extra work. So yeah, that's that. That's for my nursing clinicals. So my nursing class. Holy moly, I'm ripping my book. For my A&P lecture exam, my professor doesn't. He didn't really post his PowerPoints. What he puts up, he puts the I guess like a lecture outline. If you watch my video on how I organize my books, you'll see that that's on there. But anyway, he does lecture outlines. And I take my lecture outline, and that's where I take my notes on my lecture outline. And I take extra notes if it couldn't fit in the space. I put it on another sheet of paper, marking the section and what I'm talking about so I know where it goes and what's related to. So anyway, what I do is I'll go over this to study. Whatever is missing or whatever I don't know and I don't have explained on here, I find it and I write it on here. Like, for example, let me find a piece, for example. If I didn't have expiration, the definition written out and how it works, I would find it, fill it in there, and that way when I'm going over this, it'll be there. So I'll finish my notes or complete my notes, make sure they're finalized. I'll do that probably by Sunday. And then throughout this whole week, I'll be going over this. I'll spend a certain amount of time on this and a certain amount of time on my nursing class, my nursing clinical class. So that's how I do my lecture exam. For my lab practical, I'm a visual learner. Lab practicals have never been a problem for me. I have never gotten anything less than an A on the lab practical. I just haven't. I don't know. Whatever I'm doing must be working. I don't spend a lot of time on a lab practical because all it is naming things. You remember where it was and you name it. Maybe working on the spelling, but outside of that. But this is what I do. I color it and I color the name and, so I go over this over and over again until I know it. I make a copy of this and I cross out or blank out the actual name, and all you will see was just the, this with lines going to it, and I'll go and I'll name everything and I'll write it down on a piece of paper. If I spell it wrong, I'll write it down a couple of times until I get the spelling right. And I'll go over, like, say if I'm going over this, I'll go over this thing over and over and over again until I can go over it one time and get it all right, until writing it down, and then until I can get it all right in my mind. I'll go over starting from the beginning. Where do you start? From the nose. I'll do the nose, external nares, and go all the way through and all the way down until I get into the lungs. And I'll name everything, and I'll look and make sure I've named everything. Even when I'm not studying, I don't have my books in front of me, I'm going over things in my mind. Like, for example, on our lecture exam, the kidneys will be on there, how they function, what they do, how they do things. I'm going over it in my mind, the functions of the kidney, what they do, what happens if this is messed up. Even with thinking about drugs, what happens if somebody has high blood pressure and they're taking a diuretic? How could that affect the kidneys? How does that affect the blood pressure? Because kidneys, they deal with blood pressure. So I'm always going over that in my mind. And that's how I study for my lab practicals. In anything, even if it's a lecture exam, after I've studied and I feel like I know the information, and if I can do them flashcards and name everything, then on my free time, if I'm not doing anything, I don't need my flashcards no more. I'll go over everything I know about nursing process. Every single thing. The steps of the nursing process. The characteristics, the components, the benefits. You know what I'm saying? I'll go over everything in my mind. And another tip, I think the most beneficial tip that I can give you, and this is not even to be funny, I'm dead serious. I will find somebody that's struggling in the class, having a hard time, And I don't try to be funny, you know. I say, hey, you know, I'll study with you. I got it. I understand what's going on. I'll help you out. And we'll go over and we'll study. And I'll, if she, you know, whoever it is, if they say something wrong or I don't know, I'll explain it to them. Or if they something, you know, if I ask them a question, they say it wrong, I'll say, okay, that's not right. Let me explain to you why it's not right. I'm telling you, if you can teach it, you know it. And that's the biggest advice I can give with studying for something. If you can teach it, you know it. Even with nursing clinical stuff, if I can teach you without showing you how to give blood pressure or how to do this or how, the reason why that nursing diagnosis isn't right or isn't written right, I can teach it to you. I know it. I know how it's supposed to be set up. I know what it's supposed to look like, what's supposed to be in it, what's not supposed to be in it. You know, if you can teach it, I'm telling you, you know it. That's the biggest tip. That has helped me throughout my whole college career. I've always had somebody that I was able to help or tutor along. Don't tutor if you don't know it. But if you know it, find you somebody. Find you somebody that's struggling. And not only are you helping them, you're helping yourself because they'll do better. Because sometimes the professor doesn't teach it in a way to where they understand it. But if you can help somebody and teach it in a way to where they understand it because you're a student as well as them, you're helping yourself because you're reviewing it. And you're helping them because they're learning it. I think that's it. That's pretty much all I can think of. I am always asking questions. Doing it, even if I mess up, I'll still do it. I don't let things, like, here's a prime example. We did something, we were working on something. We first learned it and we're going over questions, nursing diagnosis. I'll say that. We're going over nursing diagnosis. And one of it was like, I got something wrong, you know. And I said, well, why is this wrong? And she said, well, I'll give you a hint on why it's wrong. And it's like, I'm looking through the book. I'm looking through the book. I'm looking through the book. I can't find, you know, I can't find it sticking out at me, like jumping out at me. You know, I'm not reading it, but it didn't sit well with me. And I noticed a lot of people didn't get it either. But they were like, okay, well, you know, I'll find it some other time. No, I don't let stuff sit well with me like that. I just don't let that go. I'm going to find out why it's wrong. And the right answer. And I did. I found out. I kept throwing out stuff. And then at the end of the class, I said, was it this? And she said, there you go. So I don't let stuff sit on you if you don't know it or nobody asked the question. Ask the question. Keep trying to figure it out. Don't just let stuff go because I guarantee you that'd be the stuff that's on the exam. So that's it. That's all I have to say. As far as my study skills, I pretty much study every night. I am in my books every single night. I don't just wait till the end of the, test time to try to, let me review my notes. No. I have my week because if you saw my folders, my binders, they're scheduled out in a week. I read I read my chapters, take my little notes, highlight. I don't really take notes on my chapters, not really, maybe the key terms, but I highlight the things that I think are important that are testable. And then I take my notes in class, and then on Saturday, I go over everything that we learned that week. So I'm always reviewing. So come test time, all I have to do is review and not cram. So those are all the tips that I can give you. That is how I study. I'll let you know how that works out. Not next week, but the week after on all my tests. And I'll tell you guys how I did. Hopefully I do good. I feel like I have a clear understanding of things. And as always, thanks for watching. Don't forget to rate, comment, and subscribe. Bye, guys.